intensive care, it becomes hard to imagine that we aren't going to hit some rate of skin breakdown. But it is really unfortunate. It's a source of pain. It's unpleasant for the patient, their family. It's an ongoing annoyance, even if it isn't painful, just to have to get the dressings changed and so on. So most of us who work in long-term care really pay attention to trying to keep the skin intact. And then, of course, some people are just so thin or so heavy or have such fragile skin or insist upon laying only in a certain way that it's going to be very hard for some small set of people to avoid skin breakdown, especially as they get very close to the end of life. You know, if the person still has a long time to live, you mostly can get them to turn some, to accept you're turning them. At the point at which a person is just sort of made miserable by being moved around, sometimes you have to accept that they're going to have skin breakdown near the end.
Okay, so a couple things that she talked about, and I want to know if y'all can tell me why. She said if a person is very thin or very heavy. So if you're very thin, if we're talking about elderly patients, so she said if you work in a long-term care facility, what's she talking about?
A nursing home.
A nursing home usually. Sometimes like a rehab facility. If the person is very thin, why are they at risk for their skin to break down? What is another word we sometimes use for somebody who's very thin? She's so skinny, she's so, keep going. Poor. Anorexic, little, keep going. Thin. Yeah. Come on, there's something else.
Bony.
Bony.
Oh,
Thank you.
great.
So if a person is very thin, the reason we call them bony is because you can see their bones sticking out, right? So you've got a very thin, little tiny, or it could be real tall, but a very thin old person. So bones are kind of sticking out in elbows, bones are sticking out in knees, ankles. Have y'all ever seen this? I mean, their joints all of a sudden look very protruding because there's not much fat in the body or under the skin. Can you see what's going to happen? Anybody ever put their elbow down on the table for too long? And it hurts, right? Yes. So when you have something pointy, bony, pressing against, between your skin and another surface, usually the bed or the chair, that's going to lead to skin breakdown. And Logan brought it up, bed sores. That's what we're going to worry about in these patients. So we mostly know it as bed sores. It's called pressure ulcers also, or decubitus ulcers. Those are all words you're going to hear. That's going to be a huge concern as a nursing assistant if you're working in a nursing home. So you can understand why a very thin person would be at high risk. How about a very big person? They're not bony, so what's the problem? They are heavy. That's a very good point.
So it's harder to move.
It's going to be harder to move the heavy person. It's going to be more pressure on the spot. But there's one more thing. Think about somebody. Okay, we talked about what we call a real skinny person. What do we call, or not what do we call? Let's think about a baby for a minute. Even though we're talking about old people. Chubby, wubby, good old squishy baby. What do we talk about? Look at those cute little legs. Look at those rolls. Very good. So
they get like those sores between them and stuff.
yes, if you've got rolls, folds, whatever you want to call it, what gets trapped in between that? Yeah, but sweat and moisture. So if you are
Like my dad worked at the thing, and he said that like they would call him in to help him like he would like hold people's like fat rolls up and they would clean them, and he said that it would like stink.
absolutely.
Like, really nasty.
When we're talking about sweat and bacteria mixing together, a prime place for that's going to be in a fold of fat, right? So I'm not bony, but I've got this fold of fat here, and moisture stays trapped in there. Or even worse, let's say it's on my backside somewhere, and I got a fold or a roll of fat, and moisture's down there, and my heavy weight puts pressure on it all the time. So can you see how these two extremes are both at high risk for that, right? So I want you Post-it note is young skin. You can kind of see through that Post-it note, like enough to sort of tell what color is behind it. You can sort of see light through it, but you can't like see through it. But it's thin, like it's an epidermis, so it's thin. But you can't see all the way through it. And what happens with your Post-it note if you pull on it a little bit?
It's not that.
Right, it can take a little wear and tear. You can crinkle it up, and then you can ball it all the way up, and you can still put it back in the shape it was in, right? I mean, it's going to have a little crinkle to it, but the young person's skin can really take some pressure, some pull, some wear and tear. Pick up your piece of toilet paper. Okay, first of all, what do you notice about it? It's very thin. You can really see through it, right? So how many times have you seen an older person that you can map their whole vein system just looking right through them? Because it's like tissue paper skin, right? Doesn't that, that even sort of reminds you of what old people's skin looks like. So what happens when you give a little bit of pull on that?
It tears.
It tears. It's not sturdy. That is an old person's skin. Pull on your toilet paper. So, yeah, I mean, actually, if you were so cruel to do that, but we're not going to do that, right? We're not going up to an old person and saying, hey, rip their skin. So, since we're not doing that, what is it that we are doing where we're accidentally doing that to them, whether we mean to or not?
Pick them up.
The way we pick them up, the way we move them, if you slide them across something. Right. So, even though we don't intentionally go up and say, watch me tear your skin, how about if we don't think about it and we wear our jewelry or we're in our skin system?
Picking like pins.
Oh, I mean, that any kind of thing that's a rough edge. What if we are not mindful and we think it's really beautiful to have those long fingernails? We're going to tear them off. And so there are, when you get later into schooling, there are going to be rules about that, but it's for protection of that fragile skin. Yes. Well, there's two reasons. So our protection of our resident skin. What's the other reason? Let's go back a few units. What's the other reason not to have those fake nails?
Remember we were
your cuticle.
No, I'm not talking about you. Bacteria. Thank you. Remember with infection control? Remember we talked about all the babies that were dying and they couldn't figure out why, and it was Pseudomonas under the nurse's fingernail. So this is old people's skin is fragile enough when it's dry, right? So what happens so we're talking about